treatment for this disease is a drug that's fatal on its own 10% of the time. Which is why I need your written consent before I can legally prescribe it.
Why would she lie if she knew it could kill her?
I don't ask why patients lie. I just assume they all do.
But why?
To protect you, because she didn't think it mattered. It just seemed easier because that's what people do. B, surgery to resect the tumor.
Joe Bergen does the gamma knife thing. Laser cauterizes while it cuts, saves more liver.
The tumor's way too big. He won't even consider it.
Not a big risk taker, Bergen. Won't even drink milk on its expiration date.
He has no discretion. 5.8 centimeters is past the surgical guidelines.
Would you do it at 4.6?
Why don't we just say it's 0, then we don't need them at all. Tumors grow, they don't shrink.
This one does.
95% ethanol. The ethanol dehydrates the tumor cells. Literally sucks them dry. Shrinks the tumor temporarily.
How temporarily?
Well, if we're lucky. Just long enough to fool the surgeon.
You shrunk the tumor.
Only way to get the guy
Fraud.
to do the surgery.
Fraud was the only way. There's a reason that we have these guidelines.
I know. To save lives. Specifically doctors' lives. And not just their lives, but their lifestyles. Wouldn't want to operate on anyone really sick. They might die and spoil our stats.
Bergen has a right to know what he is operating on.
True.
Dr. House, I'm confused by your time and date stamps. It appears that you put Carly on the transplant list before you did these tests.
I had a hunch.
You don't have hunches. You know.
Look, if the tests had come back differently, obviously I would have taken her off the list, but on the long shot that I was right, I didn't want to waste time.
Is there any exclusion criteria we should know about?
CAT scan revealed no tumors, and Dr. Wilson found no trace of cancer.
What about any other criteria?
No atherosclerotic vascular disease.
Are there any...
No pneumonia, no bacteremia, no Hep B or C or any other letters.
Substance abuse, any history
No
of...
alcohol, no drugs.
Any psychiatric conditions, history of depression?
She's a little blue, but turns out she needs a heart transplant.
Dr. House, if you subvert or mislead this committee, you will be subject to disciplinary action.
Dr. Cuddy, do you have any reason to think that I would lie?
I simply want you to answer the question. Is there anything on the recipient exclusion criteria that would disqualify your patient from getting a heart?
No. He get to you. She's the CEO of Sonio Cosmetics. 3 assistants and 15 VPs checked out who should be treating her. Who demand? I demand. I always suspected.
Dr. House, I know.
Okay. Yeah. I'd like to clear my reputation.
Oh, right. I forgot how much you care about what people think. Prescribing cigarettes for inflammatory bowel?